Today we'll be discussing the topic of period pain with podcast host Kate Downey. This is Doctor versus Comedian. I'm Dr. Asif, and this is the Doctor of Laughs.
Not a real doctor.
Ali Hassan. Every episode, what we normally do is I pick a topic for Ali from comedy and entertainment, and I question him about it. Then Ali picks a topic from medicine and health and grills me on that topic. But today is a special episode. In this episode, we'll be discussing the topic of period pain with our guest, Kate Downey, who is the host of the podcast Cramped. And Ali and I both checked out this podcast. It's very educational, very interesting, and we thought Kate would be a perfect guest to have on our podcast. Now, normally what we do is even when we have a guest, sometimes we'll do a little sidebar afterwards, another section afterwards where we go into detail about all the medical issues of the topic, in this case, period pain. But listen, Kate does this on her podcast. Even though she's not a doctor, she interviews many health experts and health professionals about period pain. And really, it's all there in her podcast. So we encourage you, after you take a listen to this, to take a listen to her podcast.
Yeah. Via katehelendowney.com, or her podcast is called Cramped, and you can find that on any place where you get your podcast.
So let's get started with our interview with Kate Downey discussing period pain.
Our guest is here, and she is ready, so let me dive right into an intro. Kate Helen Downey has built a career turning complex topics into entertaining and accessible stories. She is the creator of Cramped, and as such, she draws on her background producing hit podcasts like Dis and Tell and Glamorous Trash, live events from Malcolm Gladwell's Revisionist History, and Scamfluencers, which is a podcast run by a couple of Canadians, Scotchy Cool and Sarah Hagi, and her work co-founding the acclaimed NYC venue Caveat. Each episode of Cramped empowers listeners with knowledge, builds a sense of community for those who have felt isolated by their experiences, and pushes for systemic change. We will talk much more about Cramped right now with Kate Downey. Hi, Kate.
Hi, how are you?
Tell me, Kate, how attached are you to the Helen? Is it Kate Helen? Is it like a Mary Louise? Or is it, what do I do with the Helen?
You can drop it. There is another Kate Downey who is married to a NASCAR driver. So it is mostly for SEO.
I gotcha. There's a few Ali Hassans out there too, and we don't even want to talk about what they've done. Some of them have been very up to real no good.
Well, may I suggest a middle name?
A middle name's good. Middle name.
That's why Ali's on the watch list for the FAA. Or
the other AliHassan.com didn't do much for me. Kate, Asif, and I both got to listen to some of the podcast, and you're clearly a natural. Despite talking about something that's uncomfortable, you keep a certain level of levity and entertainment throughout, which is, I think, important for a subject like this.
I think it's one of those you have to laugh or you cry kinds of things. I've heard the podcast was reviewed recently and it was called Dark Humor. And I was like, oh, I thought I was just talking.
That's projection from the listener, I think. Yeah.
Oh, I guess that's just me.
Well, let's talk a bit about it, Kate. You refer to Cramped as a podcast investigation. You say it's one nerd's quest to find out why we know next to nothing about period pain. So let's just start at the beginning. What made you decide to create this podcast?
22 years of unsolved period pain. I get horrible period cramps. Not every single month, but most months. I have pain that makes me throw up every 10 minutes for hours and hours. Asif, I'm sure you know the term is dysmenorrhea. So I will also pass out from the pain. I've been to the ER multiple times because I can't stop throwing up or passing out. It won't stop on its own. Ibuprofen sometimes helps, sometimes doesn't. I have looked into all of the possible causes. I have asked doctors ever since I was 14, what could be causing this? How can we fix this? This is really affecting my quality of life. And keeping me from going to work, keeping me from going to school. And every single time they will give me an ultrasound, it will come back normal and they'll say, well, there's nothing wrong with you. And that's not true. So I went about creating this podcast to finally get answers. And I note in the tagline for the podcast, having a microphone gets you more answers than having a uterus, because it's true. I did not actually get a diagnosis until I was able to sit down with doctors with a microphone for longer than the, 7 minutes that you get on a typical doctor's trip, and get the information I needed to go find a specialist and get my diagnosis.
I was thinking about this as I was listening to the podcast. I'm a stand-up comedian is a big part of my life and has been for about 18 years. And so what I get a lot of is, hey, you know what you should joke about? You know what you should do up there, from people who have no... I imagine a lot of your life is like, you know what you should try? And then they go, ginger tea. And you're like, are you... That was week one, okay? That was week one 22 years ago. Don't worry about ginger tea or whatever it is. I'm sure there's a lot of stuff out there for you.
Yeah, there's a lot of stuff, and it's all in my rotation. Like, whenever someone says to me, like, oh, this thing worked for me, I'll be like, yeah, I'm doing it. I've been doing it for years. It doesn't, like, if it works for me, it's a tiny drop in the bucket, and like, I'll take it, but it's not solving the problem.
For Asif and I, on this podcast, we have to be hyper aware sometimes that we are two dudes doing a podcast, even though one of us is very qualified and also Asif is here. But we will say that, full disclosure, 3/4 of our listening audience, we found out, are women.
That's awesome.
But that being said, what do you say to men who might wonder, why should I listen to a podcast on period pain?
Yeah, well, first of all, 90% of menstruating people, and I use the term menstruating people partly to be trans inclusive, but also just to be medically accurate, Asif, I'm sure you know, not all women or people who identify as female are menstruating. People over 50 often are not menstruating anymore. People under, 13, 14 may not be menstruating. So when I say menstruating people, like, yes, I'm being trans inclusive, but I'm also just being medically accurate. So 90% of menstruating people experience some kind of period pain. So that means if you are a man listening to this, so many people who experience pain multiple times a year. 30% of menstruating people experience severe dysmenorrhea, meaning enough pain that their daily life is affected. They can't go to work. They can't go and do a social thing they had planned. They can't get up off the couch sometimes. They have to go to the ER sometimes if they're me. And that's a huge number of people. That's a number of people that affects the GDP. So, like, you should care because so many people in your life are in pain. And if you are a straight man, if you are planning to live a life with a woman that is menstruating, you need to know this. This is going to be a part of your life multiple times a year. This is going to happen potentially. And so I just think we all do better when we're a little bit more aware of what the people around us are going through. And if you are in a position to help or to advocate to make life better, like, your life will also get easier if we find better treatments and better approaches for period pain.
Well said.
You had talked about this period of time, 22 years you've been suffering with this, looking for answers. You've talked about dysmenorrhea, which is a medical term, but you in your podcast call them death cramps. And I actually think that's appropriate because the way we learned about dysmenorrhea in school, painful periods. You said 90% of women. Okay, I'm a bit uncomfortable. I'll take an Aleve. I'll take a ibuprofen or whatever, right? But what you describe, and you do it very well in the podcast, is another level. So I'm interested in how this relates to what you've learned about the stigma that women face with pain. And then a secondary question, why is period pain not treated similarly to those other types of pain?
And why is it because doctors are losers? Don't hesitate to say that anywhere. I always enjoy a little bit of...
I will be the first to admit I came into this podcast, came into researching, came into interviewing very mad at doctors, at every doctor I've ever seen. Mm-hmm. And every interaction I had with a doctor, every new thing I learned about how the insurance system works, about how medical education works, made me be like, oh, you know what? It's actually not 100% the doctor's fault. Like, are there bad doctors out there? Are there just like straight up dicks who are doctors? Yes. But mostly it is a systemic issue. Mostly it's a structural issue, and doctors are doing their best in a very broken system. But yeah, the period pain thing, one of the things that blew my mind when I started thinking about this, and so much, I think, Ali, you will probably understand this about topics where you just scratch the surface and then you're like, oh, it was right there. Like it was all right there, but I never like looked behind the curtain. That's definitely what this topic has been for me. We have one word for period pain, and it's cramps. We have one word for the whole span of experience between, oh, I'm a little uncomfortable and I'm going to take, like, I'm sore like I had a workout yesterday and I'm going to take an Aleve and it's going to be fine, all the way to I have to go to the emergency room. That's not okay. And the fact that we only, there's that how many words do certain cultures have for snow? It's like if something is a big part of your life and your culture and you need to talk about it in a nuanced, specific way, you're going to have a lot of different words and phrases for it. Think of how many words we have for like a stomach ache or the different kinds of stomach pain or nausea you can have. We have one word for cramps, and it's this huge range of experience, which means when I'm having horrible pain and I'm trying to communicate to the people in my life about it, whether it's my boss, whether it's my friends, my roommates, my parents, my significant other, I only have one word unless I create a shorthand like death cramps. And so death cramps has been my shorthand since I was a teenager, where I can, call my parents and be like, I'm having death cramps, come pick me up from school. Or I can text my roommate, I'm having death cramps, can you pick me up some ibuprofen? And they will understand, like, this isn't like, ooh, I'm uncomfortable. This is, I'm in horrific pain. This is an emergency. I need help. And that, like, I can't tell my boss that I have death cramps unless I'm very close with my boss. And so there's, this is why it's so important that we talk about this more openly. If I could trust that my boss knew that period pain could be this bad, that period pain could be a medical emergency, then it would be much easier to communicate about what was going on, to get what I need in an emergency. But even communicating with doctors is really hard. I've had so many experiences where I go to the ER and I'm in horrific pain and I'm throwing up every 10 minutes. And I say, this is severe dysmenorrhea. I've had this my whole life. I need an IV muscle relaxant because I can't keep anything down for more than 10 minutes, like for it to absorb into my bloodstream. I need an IV muscle relaxant and saline to rehydrate me. And then I will be out of your hair in 20 minutes. And they go, okay, you have food poisoning. Here's an IV anti-nausea. And then I'm stuck in the ER for another 2 hours while they wait to see if the IV anti-nausea didn't work. And then they finally give me morphine, which is like, nobody asked for that. Like, thank you, I'll take it. But like, then I'm going to pass out and be here for another 3 hours. And then I get a bill for $18,000. Because that ER wasn't in my insurance network. And I didn't realize it because it was the one closest to my house that I could get to. And like, it's a nightmare. It's a nightmare. And it's made more of a nightmare because doctors aren't familiar with this condition. They don't believe you when you tell them exactly what is wrong with you, often because they aren't familiar that period pain can be this bad. And it's entirely based on what doctor you see. I've been to an urgent care where I told them I was having severe dysmenorrhea. They immediately gave me an IV muscle relaxant. That was the time I learned that that worked, because they were like, great, we know what to do for this. Here you go, IV muscle relaxant, lie in this dark room for 20 minutes, and then you're done. And I walked home. So there are people out there who are familiar with this condition and know what to do for it, what will help. And it's just luck of the draw if you get someone who understands.
Is there a document? My sister-in-law has a series of allergies. I mean, so much. Parsley and pistachios and this particular nut and sesame. So she just has a laminated card that she gives to waiters. And she's like, this is my situation. And some of them, their eyes pop out. I'll be right back. And then they disappear. And some of them go, great, no problem at all. I wonder if there's something, akin to like a birth certificate, some formal thing that people can be like, here's what works for me. Please trust me. It's signed by this doctor. You can call
Right.
them something. I mean, that's terrible to have to plead your case when I know I just told you what I need and you just gave me an exact wrong thing. You extended my time here by quadruple the amount of time. That's
Well, it's interesting, like, because we have that in medicine, but, in my field, we have it for kids who have seizures, right? They go into emergency room, which may be in a small town. They don't know what to do. So let's print out a sheet of paper, laminate it, as you said, tells people what to do. But I think Kate's point is actually perfect because she's saying, yeah, but I think a lot of doctors would be like, no, just period pain, whatever. I know how to deal with this. I know how to deal with this, right? And they don't equate that to the same level as a child having a seizure, right? It's just not equated, even though the consequences could be much more significant, as you were saying. So
Yeah, it's frustrating and this is inevitable, but it's frustrating to be offered individual solutions for systemic problems, of course, because yes, the system is broken. It shouldn't work this way, but it does. And we all have to find a way to survive and navigate the system that we're in. But it's not the solution, right? The solution is not like, hey, you find a way to get a doctor to believe you.
Exactly. Yeah. No, I want to ask you a follow-up question about that. Do you think it differs your care when you come in for the severe dysmenorrhea, death cramps, if the doctor is male or female?
No, it actually doesn't. I actually think it differs a person's personal experience. So if I get a female doctor who has never experienced severe dysmenorrhea, they are going to be equally as dismissive as a male doctor who's never seen it. If I get a male doctor who had a sister or a significant other who, if they have seen it with their eyes, what it can do to people, they get it. They know what it is. They've looked into it. Even if they don't have the solutions, even if they don't know exactly what treatment will work, they believe me. But that really is the luck of the draw.
That is, I think, very insightful. I think that's absolutely correct because, as you said before, we don't learn this in medical school. It's very clear we do not, and you've certainly experienced that. Yeah, I know someone who's very close to me who's a doctor, doesn't like seeing female doctors because she thinks that female doctors are like, yeah, period pain. Yeah, I get periods too. Yeah, you just deal with it. Or even when this person I know was going to give birth, they're like, you can keep working till the end of your pregnancy. You're fine. You don't need a note. I worked all the way to the end of my pregnancy. I was fine, So I think you're absolutely right. It really is their personal experience. Again, not ideal because it should be taught in medical school.
Right.
But yeah.
It's one of those things that is so widespread, so widely experienced, and yet it's not visible in mainstream media. We don't see TV shows and movies. There's TV shows, so many TV shows and movies that show somebody giving birth. That's part of the plot point. But outside of Broad City and this one cartoon that I forget the name of from the 90s, I have not seen period pain shown on screen. Young girls getting their period is a plot point sometimes, rarely, but sometimes. Carrie, My Girl, but nothing like what so many people experience. And it's dumb because, you think comedy is usually about finding a thing that most people have experienced, but not seen or heard described this way or compared to this other thing. And this is 90% of menstruating people are experiencing this thing that they never see portrayed, which means we never get a sense of what is normal and what is not normal. And so if the first time I had death cramps, I was like, I'm dying. Take me to the hospital. I was a healthy kid. I've never experienced pain like this. This must be my appendix bursting. You got to take something out of me. And the second a doctor or the school nurse was like, do you have your period? And I was like, yeah. And she was, oh, well, then you're fine. And it was to your point about how this pain is treated so differently, the second it's connected to your period, it is written off. And we let people write it off. We trust our doctors. We trust our nurses. They're supposed to know what is normal and what is not. And if I don't know what is normal, if my friends are not talking about having this kind of pain with their periods, and I just assume I'm doing it wrong, there's something wrong with me, and doctors have never heard of it. So I'm alone in this. I have nowhere to go with this. No one can help me. That's traumatic for a 14-year-old. I will be the first to say I am not like someone who has experienced a lot of trauma in my life, but I think having pain that feels like you should be in surgery and being told, no, there's nothing wrong with you and there's nothing we can do for you. And we've never heard of someone having this much trouble with their period. That's pretty traumatic.
I'm glad you brought that up. You know, when you were talking about that on the podcast, it's like a inadvertent gaslighting operation, you know, and
Yeah.
you start going, am I the crazy person? Maybe I did something wrong. And that's grossly unfair, obviously. Last year, we had an expert on the show, an expert on endometriosis. And at the time, it was one of our most listened to episodes. Very, very interesting,
Good.
even for Asif and I, too. What did you learn about endometriosis and how it connects with your journey with period pain?
Yeah, well, what I learned is that I have it. So I have endometriosis. I had to go to a specialist and pay out of pocket to get diagnosed because even though I pay $500 a month for insurance, they will not do the surgery because my ultrasound comes back clear. What I learned from this specialist is that is kind of the most common story is you have horrible pain, you have all these symptoms, you get ultrasound after ultrasound over the years, they come back clean because either the gynecologist has not been specifically trained in what endo can look like on an ultrasound or an MRI, or sometimes, most of the time, endo doesn't show up on an ultrasound or an MRI because it is part of your quote unquote normal tissue. Even though it is in a place where it should not be, it often does not show up on imaging. And so currently, the only official way to get diagnosed is to get a laparoscopic surgery, which is a minimally invasive surgery, but it's like still pretty major surgery. To find visually, the doctor has to find spots of endometriosis, take a sample, and get it tested in a lab to confirm diagnosis. And so you can't even get diagnosed. And I've heard horror stories of people whose insurance won't cover the surgery without a diagnosis, but the surgery is how you get a diagnosis.
Get the diagnosis, yeah.
And so they're stuck in a loop. And it's like you have to move heaven and earth to even get that covered, to even get a doctor to be able to do the thing that is going to get you the diagnosis. And I mean, horrific. I'm sure the endo specialist covered this, but like most gynecologists do not know how to do this surgery because it is not reimbursed very well by insurance companies. And so there's like disincentive to learn this surgery, to get the equipment, to do all this stuff. So to actually get the right kind of surgery for endometriosis, generally you have to go to a specialist and you have to pay out of pocket. And it's tens of thousands of dollars. It is very expensive. And it's like 1 in 10 people with uterus has this condition. We cannot only treat this correctly if you have thousands and thousands of dollars to throw at this. It's really sad. It's really bad.
But like insurance companies, Asif, we could do like an entire quarter of a year about the absolute gross behavior of insurance companies. Anyway, this is my own little...
Like this is a thing that has gotten so much worse. I have learned in the last 15, 20 years, like when I was born, it wasn't like this. And I think we are clearly, someone got murdered in the street about this, right? Like we are clearly at a point where we have to reckon with how broken the system is and how difficult it is to get care. And it is to be seen how that happens. And it's not just people with uteruses. It's not just endometriosis. Pick your condition. Insurance is not doing good for it.
I want to ask you a question about bias. We talk a lot about bias on this podcast, especially in the medical world. But how do bias and discrimination increase the risk of like this medical trauma and neglect for people with period pain?
Yeah, boy, it's turtles all the way down. Like that's what I was totally shocked by. And I'm 36 years old. I can't believe I got to this age and I didn't know. It is so on every level. So you go to your doctor for a really basic thing. The individual doctor might have bias, like we talked about, might have not seen severe period pain before, might not have any idea that it's something that can be so severe. And that's, I think, the level of bias that we like think about the most is, oh, is this other person going to believe me, going to treat me well? But the bias is embedded so much deeper to the point where like we haven't, as the theme song to the podcast says, we've never really studied the female body. And I mean that literally. Like, first of all, from 1970 to 1993, women of reproductive potential were banned from participating in clinical studies. So that's a lot of years of like huge technological advancement, huge advancements in science that women and female bodies were just not involved in, not considered, not tested. It was just assumed that we could take whatever findings we have from male bodies and extrapolate those to female bodies. And it turns out that's not true. It turns out because of hormone fluctuations and a variety of other factors that we don't even know yet, every organ in the human body functions differently from female to male. So your liver does not function the same as my liver. My stomach digests differently from your stomach, especially at different times in my hormonal cycle. So we don't test that. And we still don't. To this day, we don't test as much. I think it depends on what you're testing, but women make up a minority of people involved in clinical testing. But it goes even deeper because rats and mice and cell studies is overwhelmingly male rats and mice are used in animal testing, and male cell lines are used in cell studies, which means from the very beginning, the first like tiptoes into studying a new drug, a theory, a treatment, it's all being tested on male cells and animals and humans. And that means women have much higher adverse reactions to drugs. They change the doses of medications just based on weight for women. But like I said, digestion is different for women and different parts of their hormonal cycle. So for example, I'm on an SSRI, an antidepressant. What I learned was that SSRI is processed differently, has a different effect on me in, my follicular or my ovulatory phase versus my luteal phase, where my body is making, in my luteal phase, which is the part of your menstrual cycle before you get your period, you are producing less serotonin naturally. And so ultimately, drugs should be dosed very differently for ovulating people, especially antidepressants and things that affect the serotonin in your system, because there is not a steady amount of serotonin in my system naturally the whole cycle. And if the whole point of a drug is to regulate the amount of serotonin in your system, shouldn't we figure out how that drug is affecting people? Over half the people taking it are women, significantly over half, because women are prescribed antidepressants and anti-anxiety meds at a much higher rate than men. And so why are we not concerned or curious or interested in how our bodies are metabolizing and affected differently by these medications? So that's a level of bias that I wasn't aware of, and I now am, and I'm very mad about it.
As you should. We talked about this many episodes, Asif. I have this love for comedy and fascination with this world. One of the most fascinating things, and I don't mean that in a positive way, was Joan Rivers was pregnant, and this is the 1960s. She was pregnant and doing a set on one of the main networks, one of the major networks, and they said, you cannot mention your pregnancy, and they had to crop the camera up high so they didn't show her belly. If that's your society in 1960, what do you think is going to happen with treatment of women for decades and decades after? And I think you just laid it out. You literally laid it out in so many different offshoots from not just pregnancy, just from being a woman. You are not going to get the care as a human being if people can't even address pregnancy. That's too intimate. Yeah. You all came from this. What are you talking about?
Yeah. Well, Asif, I'm sure you have come across this. The classic example is heart attacks present very differently in men than in women. And women die of heart attacks at a much higher rate because our symptoms are very different than how men present with a heart attack. But what doctors learn in medical school is only how men present for heart attacks. So if you as a woman are like, something's wrong, I feel weird, and you go to the ER, the doctor who is treating you may not even know what to look for to tell if you are having a heart attack, because you're not going to have like necessarily chest pain or like pain in your left arm. You might have nausea. You might have dizziness. You might have a totally different set of symptoms, and they may very well go, you're fine. Like maybe you're stressed, which is the classic. Maybe you're stressed. Maybe you're lightheaded. Maybe you need to eat something. Like maybe you're anxious, go home. And then you go home and you die. So this is finally starting to change. And at least for things like heart attacks, which are distinct medical emergency events that are pretty easy to tell what happened afterwards with an autopsy, we are finally changing the way that medical education works for that. But there are so many doctors out there who have already gone through their education and are not going to necessarily like get updated or take it seriously. And so, yeah, being a woman in this medical system is really dangerous.
Yeah. Kate, just, the medical system is broken. You have illustrated that in many ways. The insurance industry is run on profit and greed and not care for actual human beings. You've illustrated that. It's also, we ideally, and it's not always possible, love to end on a hopeful note.
Yeah.
Is there one? Is there any new research on period pain that has come out with respect to causes or treatment? Is there stuff that you feel hopeful for younger women maybe who haven't had to go through what you have gone through and may not have to?
Yeah, it can be a real bummer talking about this, researching this for a whole year. I for sure have gotten depressed, but there are a lot of reasons to have hope for period pain. So I'll start with the research. There's some really incredible research happening all over the country, but I went and visited a lab in Evanston, Illinois called the GYRL lab, the Gynecological Research Lab, which is GYRL spells girl, I guess. So scientists being cute, but they are doing foundational research. They are doing research into the mechanisms of period pain, into how the brain interprets period pain. They're doing stuff that's so basic, or it seems so basic that it seems so dumb it hasn't been done before, but they're literally putting women who are experiencing dysmenorrhea into an MRI and having them squeeze a bulb when they are feeling pain. So they can look at what the uterus is doing on the MRI and match it up to when the woman is feeling pain. And that seems so basic, but they're literally just trying to figure out what exactly is causing the pain. And what they are finding is that their pain does not match up exactly to when the uterus is contracting. We've always thought that the uterus contracting, the muscle of the uterus contracting and losing blood flow, losing perfusion, is what causes the pain of period cramps. But what they are finding at the GYRL lab is that's not true. That often women will have pain before a contraction even starts, or in the middle of one, or at the very end. But it's clearly not just the action of the contraction that is causing the pain that they are feeling. And they don't know what it is yet. So it's like, okay, we should figure that out, right? 25% of people who experience severe dysmenorrhea are NSAID resistant, so ibuprofen does not work for them. We don't know why, but they are looking into that. They are trying to figure that out. That's a huge amount of hope. Like I went and talked to the folks who are running this lab, the researchers and the scientists who are working on this. They are really, really smart, and they are really dedicated to solving these problems. They understand how disruptive this is. Like they're on it. And it makes me feel so much better to know that these incredibly smart, dedicated people are looking for answers. I'll give the caveat of the NIH has frozen funding. As of right now, I checked in with them. I was like, you guys okay? You still have money? And they let me know that their current research studies are funded, that they are not in danger, but obviously future funding, big question mark right now. So there's that. Secondly, there is a study that was done by Dr. Laura Payne, She's a psychologist, and she was looking at group therapy for menstrual pain, which is like, you really don't think of group therapy as something that can help for something like severe cramps. But what she found was that just the act of being in a room together, having conversations with other people who experience what you experience, who understand what you're going through, and who validate your pain actually lowers the amount of pain that you feel. Like statistically, like you rate your pain lower if you have had the opportunity to talk about your pain with other people who also experience it. So that's hopeful because that is something we can all do. We can all just start talking to each other more and more openly and more publicly about our pain, and know that just the act of talking about it is going to help people, because our brains do not like feeling alone and isolated and hopeless. And so having community literally lessens our pain. That, I think, is very hopeful.
Kate, thank you so much for what has been an incredibly insightful, illuminating chat. I was already illuminated from listening to the first episode of the podcast, but I think you really approach these subjects with a type of grace and humor that they don't necessarily earn. But I think what you do is you give people an entry into some tough subjects. Otherwise, some people will back away and be like, this is too difficult. I don't know if I want to talk about this or think about this. So thank you for doing what you do. And it was a pleasure to have you on.
Thanks so much for having me. This is my dream pairing, by the way. Doctor and a comedian in a room with me. Like, I am in heaven.
Well, great. We plan to be in this room for quite some time, so let's do something together again.
Absolutely. Sounds good.
Thank you, Kate.
Thanks so much, Kate.
Folks, that's our episode for today. You can find more about Kate, and we encourage you to do so, katehelendowney.com. You can go to her website. From there, you can link to the various podcasts that she produces, and of course, the one that she created and hosts is called Cramped. You can find Cramped through katehelendowney.com, or you can find Cramped on Apple Podcast, Amazon Music, Spotify. If someplace hosts podcasts, they probably host Cramped.
Check it out. I really liked listening to her podcast. She's very knowledgeable. Again, as we mentioned in the beginning, she's not a physician, but she interviews lots of people, has developed with her research this level of expertise in it. Really fascinating. And the theme song, which she alluded to in the interview for the podcast, is really funny. It's done by a TikToker, and Kate was telling us offline that she licensed the song for it. Really good song, talking about basically how women have been underrepresented in medical research, as Kate talked about. So definitely check that out. Reach out to us. Let us know what you guys thought about this episode. drvcomedian@gmail.com, drvcomedian on Twitter, Facebook, Instagram, Blue Sky. We are everywhere. Ali, what do you got going on this spring? April
I'm here and I'm there. I'm doing a little of this, and I'm also doing a little of that.
Excellent.
Standupali.com is where folks can find out that information. But I'll be doing a little zigzagging around this country.
Okay, good. Now remember, Canada. Ali, of course, the country of Canada. Everybody's very proud Canadians these days. So check Ali out.
I was doing that before it was trendy. I was proud for quite some time. And then I wasn't. And now I have to be again. Elbows are up. Okay.
So remember, Ali's not a doctor. Kate's not a doctor. And even though I'm a doctor, I'm not your doctor. Medical issues we talk about for your interest and information only. And they're not medical advice. Please consult your medical professionals for actual medical advice. Thanks for listening.
See ya.